Very good morning, all of you. And today we are going to revise the topic hospital formulary and the guidelines related to that hospital formulary. Long back we have discussed about this topic, and once again we are going to revise with the additional informations how the things are going on around the world about hospital formulary. Hospital formulary is a small part of the formulary system, I say, because formulary contains the list of medicines practiced by pharma community throughout the world. And this formulary, we can say by a simple word, it is an index of medicines. This formulary, many way practiced in worldwide, depends on the need. One is international formulary, another one is national formulary, next level is general formulary, another one is state formulary, joint formulary, and then only the last form of the formulary is hospital formulary. International formulary is followed throughout the world. Everyone, for everyone it is applicable. It is supplied by World Health Organization and maintained by World Health Organization. Hello.
Yes, sir. Yes,
Okay.
sir.
Okay. Uh, with this introduction, we move to what is formulary. We discuss about what is formulary. A formulary is a list of medicines. Traditionally, a formulary contain a collection of formulas for the compounding and testing of medications. That was old type of formulary. Their formulas will be given, but currently pharma industries are giving ready-made formulations. So we are concentrating on the dose usage, the nature of formulation and their storage conditions, precautions, adverse drug reactions, contraindications. These informations only now occupy all the formularies. Old formularies, if we take, it contain formula for compounding the medicines. Today, the main functions of the prescription formulary is to specify particular medications that are approved to be prescribed at a particular hospital in a particular health system or under a particular health insurance policy. Some countries, uh, every for everyone, it is mandatory to have a health insurance policy. So they will have a prescribed format how the medicines to be, how the treatment to be given. So based on the therapeutic plan only they will prescribe medicines. So that will be listed in that practiced formulary. So they will adapt that formulary only to maintain a proper uniformity throughout the country. So for that reasons they will maintain. The development of prescription formulary is based on evaluation of efficacy, safety, cost effectiveness of the drug. Depending on the individual formulary, it may also contain additional clinical information such as side effects, contraindications, and doses. So these all collective information only called that compendium is called formulary. It is a general statement about a formulary, and this formulary is an official or unauthorized publication. If it is supplied by government, it is official. Otherwise, it is an unauthorized publication like SIMS. Approved list of medicines for use in a hospital, a group of hospitals, a society or a state or a region of a country, of many countries. So like that it is practiced. Hospital formulary means it is made only for that particular hospital. That hospital formulary is a continually revised compilation of pharmaceutical dosage, uh, agents and their forms that reflects the current clinical review of the medical staff. So that is called hospital formulary. Uh, in this hospital formulary, what are the various other informations, important vital informations may available means ancillary information related to toxicity will be additionally given. Unwanted side effects, if anything is there, that will be listed. Beneficial effects of some drugs which are considered most useful and safe in patient care by a hospital will be highlighted and given. So a hospital formulary is just is not a list or an index of medicines. Additionally, it may give many information related to the medicines. So any new hospital healthcare professional are practicing, it will be a very informative source for them. They may learn many things from this hospital formulary. National hospital formulary we saw in the beginning. National formulary, very popular example is USPNF, that is followed in the United States. USP is, you know very well, United States Pharmacopoeia. And you should know the difference between pharmacopoeia and formulary. That is, there is a vast difference. Pharmacopoeia contains standards for analyzing the medicine and the purity, impurity levels in the medicine, like that, and their descriptions like that. So it speaks about standards, analytical procedures. That is pharmacopoeia. Formulary means about a formulation, about a dosage form, what is the strength, what is the various storage conditions, what is the contraindications, what are the safety related informations, how the medicines can be used, what are the and it will be classified according to the pharmacological classification category, and which are the conditions it is safe, like that. The details will be given. That is formulary. In United States Pharmacopoeia, formulary also merged with this, a part of the pharmacopoeia nowadays. Both are in one, supplied along with pharmacopoeia only. So we used to call USPNF, National Formulary. Short form is NF. That is a very popular national formulary followed in US. And this is NFI, National Formulary of India. This is our formulary, Indian formulary. And this is British National Formulary, BNF. It's very popular, we very informative, and we can learn many things. For an example, I took the screenshot of the content page of this formulary. What it contains, we'll see. It contains free preface, acknowledgement, how to use British National Formulary, changes for the edition. So what are the changes made in this edition? Significant changes, dose changes, classification changes, discontinued preparations. You note this, discontinued preparations. That means in the previous edition it will be there, in current edition it is discontinued. And the reasons will be given there. New preparations included in the edition, late edition, name changes, guidance on prescribing, general guidance, prescription writing method, emergency supply of medicines, controlled drugs and drug dependence, adverse reactions to the drug, prescribing for children. Apart from this, various classifications based on the pharmacological classification, drugs used in gastrointestinal system, cardiovascular system, respiratory system, like that. And then appendixes. Appendix contains interactions, liver diseases, renal impairment, pregnancy, breastfeeding, intravenous addition. Uh, all informations are there. So one new pharmacist, one new healthcare professional joining in a hospital, this will be a very informative source for him. He can learn many things apart from the list of medicines practiced in the hospital. And examples of national formularies are, what are many countries have their own formularies. For example, Australia following Australian pharmaceutical formulary. Austria is following Austrian national formulary, and British national formulary. Uh, and they have one more, British National Formulary for Children, BNFC, pediatric use medicines. The Croatian National Formulary, German National Formulary, Dutch National Formulary, Indian National Formulary, that is called the National Formulary of India actually. Kazakhstan National Formulary, Sri Lankan Formulary, United States National Formulary. I told you in the beginning. Later brought out and merged with the United States Pharmacopoeia. Now it is supplied along with Pharmacopoeia. It's the only country supplying along with Pharmacopoeia. On international formulary, this is an picture of international formulary given by, circulated by World Health Organization. World Health Organization model list of essential medicines and World Health Organization model formulary. So this is the formulary supplied by World Health Organization. It is available in their website free of cost. It is made in many international language: Arabic, Chinese, English, French, Russian, Spanish, and it is circulated among very many countries. Small countries, those who don't have their own national formulary, they are following this. But these discussions are not related to hospital formulary. Hospital formulary is developed from this national formulary, international formulary only. This is one example I taken to show you a hospital formulary. The cover page of hospital formulary practiced by Department of Pharmacy, Government Medical College Hospital, Sector 32, Chandigarh in India. One hospital is following, so the hospital name will be mentioned in that. So it is applicable only in that particular hospital. So in that hospital, what are the available medicines are there in pharmacy? They are listed there. Okay, we move to the next discussion part: the need for hospital formulary. Why it is required in a hospital? The increasing number of new drugs manufactured and marketed by drug companies. So keep on adding new formulations. People will be confused and need to be updated their knowledge. So a formulary system is very much important. Increasing complexity of untoward effects of modern potent drugs. That is also a reason we have to know about their safety informations. Keep up. We are. It is everyday informations are added in this field. Newer sale promotion strategies of pharmaceutical industry. So that is also a reason. New formulations are supplied and new advancements are made. So that should be updated to healthcare professionals. Those who are practicing. The public interest in getting possible healthcare at lowest possible cost. So they can compare which is cheaper, trade name wise. So that can be chosen. For OTC medicines, there is no restrictions. They can follow formulary and they can take guiding principles followed in making of hospital formulary. Hospital is making a formulary on what basis? The governing body of the hospital shall appoint and a hospital therapeutic committee, pharmacy and therapeutic committee, composed of the pharmacist. That PTC will prepare the hospital system, formulary system. Okay. Guiding principles, we continue. The PTC shall develop policies and procedures governing the hospital formulary, and the medical staff shall adopt these to administrative approval. And that is one step. Next is the policies and procedures shall offer guidance in the appraisal, selection, procurement, storage, distribution, use, safety procedures, and other matters relating to drugs in the hospital. So, in various ways, the guiding principles will be applied and shall be published in the hospital formulary or other media available to the members of the medical staff. Like this, only the medicines are listed in hospital formulary. And the medical staff shall adopt the policy of including the drugs by their non-proprietary names. Non-proprietary names means generic names. You have to write and use only the generic names. Like that, the policy will be developed in the hospital. And in the absence of written policies approved by the medical staff, the pharmacist shall dispense the brands prescribed. If there is no policies like that, then we can doctors used to write trade names and like that only the pharmacist will dispense. The formularies will may contain that trade names also. The hospital shall make it certain that the nursing personnel must be informed in writing about the hospital formulary system existing in the hospital for its effective usage. So they are only practicing. So they should know very well about this hospital formulary. In the formulation of policies and procedures, the terms substitution should be avoided because these terms can be used for dispensing entirely different drugs. So the pharmacist may start to dispense other than the prescribed medicine. So these words should not be used. If there is any change in hospital system or in the contents, it must be informed to the medical staff. Uh, so a meeting in the PTC meeting, it can be informed and necessary changes can be made. And the labeling of medicines with non-proprietary names should be always be done in a proper manner. The format is as follows. Uh, uh, that is name of the drug in non-proprietary name, amoxicillin, ampicillin, that like that. Name of manufacturer or distributor, prescription or order by the proprietary name. That means it should be written only in the proprietary name. Dispensing is done according to the formulary policies. So these are the guiding principles that will be strictly adopted in hospitals. Apart from this, we see how formulary gives informations. Uh, this is a page taken from a formulary. This is a prescription, how it should be written, the guidelines given in a formulary. Uh, in a hospital for inpatient purpose, we make medicines and we label to a particular patient. How the label should be made, it is given on guideline is given in formulary. These are the additional informations always given in formulary. Patient, this one, number one indicates patient's name, gender and age, that should be written here. Two is patient's registration number. Three is the date of dispensing. Four is name and strength of the medication here, which is the dosage form, what is that quantity, strength, and the name of the generic name of the drug, non-proprietary name. Route of administration should be written. Fifth one, two times a day, and measures and frequency. Dispensed quantity, this is the quantity, and expiry date of the unopened, unconstituted medication. That is this one. Advices on food intake, this is the area in which should be written. Controlled medicines, if it is comes under this category, that should be written very clearly here. And then name of hospital and contact number, that should be written. So like this the labeling should be done and it should be supplied, that is given in formulary. Parts of hospital formulary, what are the informations it may contain? It's one sample information we have discussed in the beginning. Introduction will be there. We have seen this content page of British National Formulary. Just to remember, basic information on each drug, supplementary information on each drug, prescribing and dispensing guidelines, general drug use and advice, miscellaneous sections, all will be there. This is one sample page taken from British National Formulary. You see here, diltiazem hydrochloride. It is which category? You can see here, cardiovascular system. It is written here, cardiovascular system medicines, and here calcium channel block. This is a subcategory here. It comes under this subcategory. It is given here. And this is diltiazem hydrochloride. It's a non-proprietary name of the medicine. Accordingly, alphabetically, it is arranged. Here, indication, caution, contraindications, side effects, dose, standard formulations. That means marketed drugs. Here you can see the brand names and their dosage form, their strength, and longer acting formulations, and capsules are available, and these are capsules. This is a tablet, like that the list goes. This is British National Formulary. It is a national formulary, and this is a sample page taken from hospital formulary. Now you see the difference. This is hospital formulary gives a list of medicines. This is dosage, and this is related informations and safety informations are given in this column. Take this example as here. This is category is given analgesics, anti-inflammatory. Under that, acetyl salicylic acid tablet, and one more acetyl salicylic acid tablet 150 mg. This is 350 mg. In hospitals, what are the different strengths available, strength of medicines available, all will be listed here. See the diclofenac sodium injection 3 ml ampule, 25 milligram per ml. Diclofenac sodium tablet 50 mg. Diclofenac sodium gel 15 gram tube. Diclofenac suppository 12.5 mg, 25 mg, two variations, and 100 mg, three variations are available. So one new healthcare professional, what are available in our pharmacy, they may get complete information here. And then here in the safety informations are given: upset stomach, nausea, heartburn, diarrhea, constipation. It can cause temporary infertility in men, particularly those who take it regularly. So all informations are given. And apart from this, here, this area, this ticked area, some information will be given. That is, drugs marked with symbol star. Here, star symbol is there. They are drugs available in OPD. So these medicines are available in OPD. So this is not available in OPD, only for inpatients. And Y symbol here, somewhere it will be given in this section top. It will be given this Y symbol that indicates that the side effects are listed here. Kindly contact the prescribing physician if that kind of side effects are noted. So that is the additional information. So this is hospital formulary. See the difference. There is a large difference between hospital formulary and national formulary. So what exactly required in a hospital, that is only given here. This is one more sample page taken from a hospital formulary. Omeprazole tablet 10 mg, 20 mg, indications and dosage, and contraindications, adverse drug reactions, like this also. And this is pharmacological category of the drug. So like this also, the drugs will be given. It's the necessary information. What is exactly required for the physicians in emergency, for emergency reference. So there should not be any story. Very short informations, easy to refer information should be given. Preparation of formulary. A typical formulary will have the composition in the following manner. It will have a title page, name and titles of the member of pharmacy and therapeutic committee, and table of contents, information on hospital policies and procedures concerning drugs, and size, how many pages are given, and format. It may be a loose leaf like this, or bound, printed, or a mimeographed, means xeroxed pages. Indexing and assigning categories, general index, pharmacological index. So like that, various methods are followed for the preparation of formulary. Preparation and management of hospital formulary. How a formulary is made at various stages, we see. Stage 1 in the preparation and development of formulary is, first stage is administrative stage. It requires formation of PTC in a hospital. If first PTC is to be now functioning PTC to be there in a hospital, then only formulary will be effective in a usage. Develops the concept for policy and procedure for medication. So based on the policy only, we can make a list of medicines in a hospital. And we have to select according to the policy a suitable manufacturers whose medicines to be listed in our hospital, and their strength, the quantity, source of supply, all. So that is stage 1. Stage 2 in a formulary making is deals with development of drug formulary list. According to the policies, according to the selected manufacturers, we have to make the list of medicines. So selection of therapeutic classifications. Uh, Based on the departments available in our hospital, patient populations, experts, physicians in our hospital, specialty wards in our hospital, we make list of medicines, and collection of necessary data for analyzing the existing pattern, and analyzing the morbidity and drug utilization pattern, conduct drug class review, approve the formulary list for use in the health facility. So we have to get approval from the PTC, and then educate hospital personnel and policies and procedures, non-formulary drug use, and additions, deletions, which are currently in practice, that should be maybe removed for various reasons. Finally, we make a list. After making the list, after development of the list, then it is procedure to third stage to develop drug formulary manual, which includes drug formulary manual. That includes the formulary manual versus formulary list. So that is all additional informations will be listed. How the formulation to be administered, practiced, stored, all information. Develop policy regarding general information section, monograph, formulary manufacturing, special information section, and indexes to facilitate the use of manual, and procedures to distribute the manual. So all will be developed. Then fourth stage only, making the formulary. Developing and implementing standard treatment guidelines. So if these treatment guidelines are not in practice, formulary system will not be adopted by physicians. So this kind of symptoms, like this only it should be treated. So these are the list of medicines. Within this, you prescribe. Like that, we have to give a guideline, and we have to evaluate the system also continuously and make changes in that. And implementing adverse drug reactions and monitoring the system. So that will be keep updated in the formulary. Formal process to review medications and policies should be implemented in the organization. Expert panel on subcommittees in the PTC, they will function to keep update the information given in formulary. For example, PTC may have subcommittees in the area of antimicrobial, cancer therapy, cardiovascular, adverse drug reactions, like that. They may have subcommittees. So they will keep adding informations to update the formulary system. So these are the various preparation and management system followed in hospital formulary. There are 4 stages. How revision of formulary is done, we discuss in the next class. Now time out. Okay, uh, we continue in our further discussion. I'll stop recording.